that the biggest component of health care is prevention. Health means avoiding sickness. Doesn't mean being sick and being treated. And all the preventive measures, we have repeatedly outlined them for you.
This specialized women's and neonatal hospital is important to me because I know that people need quality specialized health care. And since specialized health care is not yet available to all people, this hospital is truly the lifeline now to the majority that need it.
Life starts with a healthy mother, a healthy child. The Uganda Demographic Survey of 2022 shows a reduction in Uganda's maternal mortality to 189 per 100,000 live births. To ensure a healthy and productive nation, the government of Uganda has been allocating funds to the health sector to establish facilities that offer health service up to referral level. The First Lady of Uganda, Honorable Janet Kataha Museveni, has been at the forefront to ensure the life of a mother is protected.
It means life-saving for both the mothers and the neonates, especially those who are born prematurely. And at Mulago right now, there are many who are there. And it's just a blessing to know that they have this facility that can take care of them.
Constitutionally, the government of Uganda has an obligation to provide basic health services to its people.
The Parliament of Uganda saw it important that women should have their own hospital to offer specialized services.
In line with this obligation, in 2018, the government established the Mulago Specialised Women and Neonatal Hospital. The 450-bed facility, built by the government of Uganda with a loan from the Islamic Development Bank, provides highly specialized reproductive and neonatal treatment and healthcare services.
We came from Mulago Hospital. Before 2008, we used to offer services as obstetricians and gynecologists. In 2008, a concept came up of sub-specialization. Obs-Gyn was broken down into maternal-fetal medicine, reproductive medicine, urogynecology, gynecology, and benign gynecology. At that time also, we had the special care unit on the 5th floor. It was a little small and it was not as well equipped to cater for the newborns, especially in complex areas. Hence the need for a specialized hospital like this coming into existence. We are seated on a 24,000 square meters, and this hospital was funded by the government of Uganda at a cost of $33.4 million US.
The hospital supports government policy of developing the health sector and reduces maternal and neonatal mortality, thus improving healthcare service delivery.
That time before we became a specialized hospital, we are dealing with all the different spectra with no specialization. But now with specialization, we are able to receive patients who need this kind of care coming in through the system. From the 2022 UDHS, we see that the maternal mortality, for example, has reduced.
The hospital has a mandate to provide highly specialized reproductive and neonatal services, hence contributing towards Vision 2040.
We do have a high-risk obstetric clinic, the first of its kind, and here we find teams of obstetricians working together with other teams, including the pediatricians and radiologists. So holistic care is given and timing of delivery is carried out.
The hospital employs 400 staff trained to handle complex cases. This is a priority as the country looks forward to achieving Vision 2040 and the UN Sustainable Development Goals. Dr. Kagawa Mike is a specialist in maternal fetal medicine, which is a subspecialty of obstetrics, focusing on diagnosis and treatment of expectant mothers and unborn babies.
We used to define a pregnancy which is ready to come at 28 weeks because those babies are the ones who are big enough to survive. Now we have lowered that age of these babies to 26 weeks. We have also seen that back in the day, babies who would survive would probably be more than 1.5 kilograms. Those would even survive with a lot of difficulty. But now we are able to save babies as small as 800 grams, 900 grams, less than a kilogram. Because we monitor them, try and make sure they grow to a size which is good enough, but sometimes we are not able to do that. And when that is not possible, we deliver them and hand them over to our colleagues in the neonatal unit to try and make them survive, and they are doing a good job there. Most of the mothers we see are those mothers who have had challenges either getting pregnant or having a baby successfully. So what we try to do is help them go through pregnancy safely and get a live baby. I have been seeing a mother who got a clot in the lungs. This is not something which can be managed in a lower level facility. Another mother we are managing right now is a mother who has had recurrent pregnancy losses. She's now having her fourth pregnancy, but she doesn't have a living child. So we are monitoring her. She's been losing them. The pregnancy progresses up to a point, and then she loses the baby. So right now we are monitoring her to ensure that the baby is safe. And if for any reason there are signs that the baby maybe is in danger, and we think the baby is better off outside, then we deliver the baby.
On the third floor is the Neonatal Intensive Care Unit, NICU, for the newborn babies who need intensive medical care. The unit has advanced technology and trained healthcare professionals to give special care for the tiniest patients, including babies who need specialized nursing care. Dr. Jessica Nachibuka is a pediatrician, certified neonatologist, and consultant at the neonatal unit.
And this is where I and my team must be very impeccable in ensuring we do not lose time, we quickly make decisions, think for this baby the way the womb would think for them, or the way the placenta would be acting if the baby was still in the womb.
Miss Janet Akatukwasa gave birth to a baby boy, Jesse Ahumuza, on 6th August 2023 by cesarean section. Jesse was 6 months and 1 week at birth, weighing 1.5 kilograms, which declined to 0.94 kilograms upon arrival in the NICU.
Of course, it was not a good experience. I'd never seen such a small baby. I was so scared. I didn't know whether we were going to make it or not. So it was not a good experience at the first sight. But 5 weeks down the road, we have moved on. He has put on weight. We are about 1.2 kgs now. He has received good care. I can say the treatment is so good because I think at one time I had lost hope, but where we are right now, I see we're almost getting discharged, going home to manage him further. It was all a new and hard experience, but with the help of the nursing care and the doctors around, we have pulled through.
Apart from counseling on how to take care of the little one, Annette appreciates the hospital management and the government for the facility that keeps their hopes alive.
I thank the government for this arrangement, for such facilities, that we don't have to move out of the country on such emergencies to look for such services, and we can get them right here in our country. May I say in Kampala, we are getting the best we can get. The nurses are so good and so kind. Actually, so comforting to us. The way they handle their babies, we appreciate.
We've had small babies as small as 300 grams, 500 grams, half a kilo. They cannot go home. They will not survive. So that's when kangaroo comes in. Kangaroo is another low-cost intervention. We encourage mothers to put the baby skin to skin on their chest immediately at birth. It's being encouraged now. Or further down the road, the baby is stronger, more stable. We encourage kangaroo immediately. You have to engage the mothers early. They are more involved in the journey, even at home.
I first went to Kawempe National Referral Hospital. Then Kawempe referred me here, and the doctors welcomed me. They first counseled me because at first I was scared. Being it was my first experience. The reason as to why mothers do kangaroo, it helps the baby to gain weight. It also builds the bond between the mother and the baby.
Taking care of neonatal babies sometimes becomes overwhelming to the nurses, given the big number of babies who need care.
It is overwhelming. I sit here in the morning. You see the nurse moving from, of course, after the doctors have made their round, the nurse is moving from one baby to another from morning until they check out. You don't see them going out to take break tea. You don't see them going out to take lunch. I always wonder how they be so sober to do everything right, but they try.
We have babies who are born at term, what people call 9 months old, who should go home right away, but for some reason they cannot go. The babies are born tired, they cannot fend for themselves. Oftentimes the mom too is tired, mom is unwell. We cannot say enough is enough on such a baby until other experts have come in, until their input has been appreciated. These are babies who lose life and contribute to the high mortality we have in our country. So it's very important the specialized hospital like this is able to intervene and come in. Because remember, we're doing the work of the placenta. We have seen a greater improvement in the survival of very small babies. An efficient referral system. We have an oxygen plant. The oxygen is always available. 24 hours, 7 days a week. It's no longer the oxygen that would run out with the cylinder. The plants are empty. We don't have oxygen, but we have our own generic oxygen. So always have enough in supply for every baby that needs it or any critical patient that may need it in this specialized center.
The unit also cares for high-risk mothers with underlying conditions that could compromise the growth of their babies in the womb. The follow-up mechanism enables them to keep in touch with mothers.
Patients are discharged home and we follow them up. We have a clinic where we follow them up regularly. Initially it's very close, every week, then 2 weekly, then monthly, eventually to 3 monthly. And all that time we are monitoring the growth of this child. Are they gaining weight? Is their height coming up? Is their brain growing? Their brain development is very important. And with this we match it with the baby's milestones. Is this baby sitting when they should sit? Is this baby crawling when they should be crawling? Are they able to speak 1 word or 2? Can they hear? Can they see? Because the specialists are there in this center to intervene and timely capture these issues and manage them. Remember, intervention in a timely fashion gives better results. So I appeal to people out there. The hope you should have is that help is here. It is available. It is possible in Uganda. There's no need to refer or go out of the country if you're immediately told your baby is in trouble. Your baby is a high-risk baby. They're dysmorphic. They don't look normal inside. There's no need to go and seek opinions in other countries. It doesn't only take away time from you. It also takes money that could best be saved.
The hospital runs a specialized daily screening program for cervical cancer, which is very common among HIV-positive mothers. Dr. Juliet Birungi is a gynecologist who specializes in diagnosing and treating diseases of the female reproductive system, responsible for pregnancy and menstruation in relation to cancer.
We have cervical cancer is the number one. It's the leading cause of death among cancers in women. So this cancer is usually diagnosed very late, okay? And the reason is because of the poor seeking behavior. People don't screen. Yet we know it's one of those cancers that we can screen. And then if we find any abnormalities before they become cancer, we can treat them. So in the clinic, for example, we have this machine. It's called a colposcope. It basically looks at the cervix in magnification. So if someone is discovered in the clinic that they have abnormalities, they will come to us. We shall put them on that bed, and then we shall examine them using this colposcope.
Women with pelvic floor conditions affecting their bladder, reproductive system, rectum, and other rare complications like fistula are also managed here.
Somebody who is born as a woman and is raised as a woman, but when it comes to fulfillment of her reproductive functions, she's not able to do it. And then when these women come to us, we're able to create that part for her reproductive part, and then she's able to have her normal life. That is one of the difficult cases actually, which sometimes, which most hospitals cannot handle. But we have good enough people who have been trained in this hospital to handle this, especially in the urogynecology unit.
Female infertility that is caused by blocked tubes is another concern the hospital addresses at the menopause clinic.
We are grateful to the government of Uganda for bringing this state-of-art treatment modality, that is in vitro fertilization, to the people of Uganda. It is a fully fledged lab with all the equipment that you can find elsewhere in Europe and in the US. Equipment is not enough. They have gone ahead to cater for the human resource that is required to run such a sophisticated service.
Other areas of specialized care include reproductive medicine, where infertility and reproductive challenges are addressed at the Diagnostic Center for Men Fertility Evaluation. This laboratory offers couples with reproductive challenges full diagnostic evaluation of male infertility and intrauterine insemination.
Male infertility is one of the biggest challenges in our country. You know, as much as women take on the blame for not having children in a relationship, not much is known about male infertility. Many times, most of the tests you'll hear are directed towards the female partner in the couple. Therefore, if you're having a challenge out there in a relationship, sit with your partner, come for evaluation. Come here because we'll offer you the best that there is in identifying if there is a problem, and if there is a problem, the best treatment option that you can ever offer.
The hospital has a powerful diagnostics division with experts in endoscopy, laboratory medicine, pathology and radiology who use the high-tech equipment and innovative technologies.
We do organ tests very routinely. The liver function tests, the kidney function tests, the bone function tests, critical care tests for the adult intensive care units or critical care units. And then for the newborns, we have hormonal tests. Hormonal tests for the females, we have 5. Luteinizing hormone, follicle-stimulating hormone, estrogen, progesterone, and prolactin. Besides, we not only care for reproductive health of females, but also for males. You will take long distances away from this unit to go and look for a lab that can test you with quality of the same sort. Test for you those and give you results in the shortest turnaround time. In about 20 minutes, we have results for you.
The high-tech CT scan machines ease diagnosis. The services offered are cheaper and give quick results, hence an improvement in service delivery.
The government has really invested a lot, and I really thank government for that. Because of the huge investment, it has become easy that we can easily make a diagnosis without struggling. And to the patients and the public, there is improvement in health delivery to them, to the patients, because if we are good with our machines and our work is simple, that means our patients, they get the best services.
Physiotherapy is important in women's health during pregnancy and after childbirth.
Basically, we have a range of exercises for antenatal mothers. And even after they've given birth, we have a range of exercises for postnatal mothers. For example, exercises to help them to get back to shape, to get back their tummy. You know, ladies are conscious with their shapes, so we take them through those exercises. We also take them through pelvic floor strengthening exercises. You know, during pregnancy, the baby is pushing onto the pelvic floor. Some mothers actually use normal delivery, so the pelvic floor muscles get weak. So we have to strengthen the pelvic floor muscles. And we also take them through back care. When you're nursing your baby, how are you supposed to be seated to protect your back? So we take them through back care, pelvic floor strengthening, abdominal strengthening, and so many other things that we do here for the mothers. We even teach them relaxation exercises that will help them during the time of labor.
Mothers hail the healthcare and treatment at the maternity and the neonatal intensive care unit. Patience Arinetwe, a resident of Kamocha, a Kampala suburb, and first-time mother, is grateful to the hospital for saving the life of her baby boy, David Trillion, whom she delivered at 7 months.
I had gone for a checkup. When I reached there, of course, I did my tests and brought them to the doctor in a normal, very, very normal state. So, on the doctor looking at my results, the doctor told me, you admitted. Your organs are not doing well. Your organs are failing. So that baby has to move out instantly. But even before he told me that, I felt like the breathing was a problem still at that particular point of time. The breathing was becoming a problem. Then he told me, your whole body is full of water.
The health facility she earlier visited could not manage her situation and was referred to Mulago Specialized Women and Neonatal Hospital with facilities to handle her fragile situation.
I must be honest that I thank the staff of Mulago, even if I can't remember them, whoever worked on me, but I am so grateful because when it comes to an emergency, for sure, they treat you like an emergency person, for sure. When my time came, they took me to the theater. Under normal circumstances, you're supposed to be scared, maybe in the theater or what. But my scare was, is this baby going to move out alive? Is this baby going to move out dead?
The doctors assisted patients to deliver David, weighing 1 kilogram, and was on oxygen for 3 weeks. The baby spent 3 months in the neonatal intensive care unit.
All I can remember is they called me to go and check on the baby. To be honest, reaching the incubator and looking at the baby, I wasn't sure actually whether it was a baby or not a baby. I was just looking at something in the incubator. It is so scary. But the experience in NICU is not that amazing. But because of the care the doctors give, the zeal the doctors have for these babies, they give mothers hope.
The 1 year and 3 months old boy is healthy and developing normally.
You people, I am so grateful to the doctors of Mulago, honestly, because if it wasn't, then maybe we would have lost it, some of us, especially when you're a first-time mother. It's a stressful journey.
Penelope Nabunya is a resident of Entebbe in Wakiso district. At 28 weeks of pregnancy, she gave birth to triplets, Elena Amia, and 2 others in a private hospital on 10th March 2020. Unfortunately, 2 babies never survived. Elena survived with the help of an incubator. She is now 3 years and 6 months old.
Dear mothers, fellow mothers and parents out there, the facilities are there in the public hospitals, the doctors are there. It is why my own is still living. It is why I went. I didn't go to any private hospital. I went to Mulago. Please encourage your partners to go for antenatal as early as possible, because with that, you are able to foresee any challenges, and when you foresee something, there is always something that can be done to control that challenge.
This is the role of Mulago Specialized Women and Neonatal Hospital in handling complex surgeries, helping women with complications and those with difficulty to carry and stay pregnant.
We have one who had lost 10 pregnancies but was able to walk out with a live baby. And I'm glad to let you know that our smallest surviving baby was born at 500 grams at 24 weeks of age. No more pregnancies from 37 to 40 weeks. This baby was born at 24 weeks. It weighed 500 grams. And I'm glad to let you know that in June 2023, that baby made 1 year. And at 1 year, the baby weighed 10 kilograms, which is a normal weight for a 1-year-old baby.
The hospital has a mandate to medical students in obstetrics and gynecology, pediatrics, radiology, and anesthesia. It was assessed and accredited as a training center for the East, Central, and Southern College of Obstetricians and Gynecologists at fellowship level.
Training is good for us because we are preparing other people who are going to do this work when we are gone. The other thing also is that when we have training, we have students who actually are part of the human resource that we have. So while they are in training, they are also actually practicing. So sometimes that beefs up the numbers that we have, that when they are in training, they are also offering a service up to the level that they are actually allowed to practice. So I think a training center is always a good thing in any institution which needs to grow.
We also look to increasing the diagnostic, especially in the lab, as far as the high-risk obstetric mothers are concerned, being able to do prenatal diagnostic tests. So sometimes people move out of the country or abroad for this, but we believe that in the near future we'll be able to carry out these tests in our laboratory. We're already training people who can be able to do this in the laboratory.
The need for specialized treatment and care to cater for the increased demand for services at the hospital requires more human resources.
For a 450-bed hospital, indeed, the number of staff is expected to be not less than twice the number of beds. But as we stand, we have less than that number of human resource. We have about 400 staff, which is far less than what we need. So this affects care, although we are doing a lot, but we could do even more. But there is hope. This financial year, for example, we've been given more resources for wage, so we expect to be able to recruit more. But this is in a phased manner.
With this special healthcare service, in the next 5 to 10 years, Mulago Specialized Women and Neonatal Hospital will be a pillar for Africa.
First-class service, an area for medical tourism, people coming in to get services here because of the specialty that is here and the experience and expertise.
People used to travel out of this country and taking away resources from this country, which can be used for other functions. Now, in terms of the investment government has put in this place, that money doesn't need to go out of this country. So many years ago, some of these problems were not manageable. But now I'm happy to say that we are handling most of these problems which were not manageable, and women should have hope in the health system, because the government has invested money and trained people to manage the problems where they needed to go elsewhere for treatment. They can now have the treatment within government facilities.
Mulago Specialized Women and Neonatal Hospital would like to appreciate the government of Uganda, appreciate His Excellency the President, to appreciate the First Lady Mama Janet Museveni for really supporting the women cause in this hospital, to appreciate the Honorable Minister of Health and the whole team at the Ministry of Health for enabling this hospital to stand as a hospital that is offering highly specialized reproductive and neonatal services to the people in Uganda. We also wish to appreciate our clients that have got confidence in us, those that have received service, and to appreciate the staff who work tirelessly day and night to save life in this place. We receive the very sick, and all efforts are made to see that these patients do survive and come out with good outcomes.
Government has a vision to have it in all the regions of this country. It will be carried out in a phased manner. For now, some of these services are also offered in our regional referral hospitals, where women are screened, and if they are not able to be handled from those facilities, they are referred to the Women Specialized and Neonatal Hospital. So the hospital remains a highly specialized facility that receives referrals from all over the country.
This hospital is critical for the people of Uganda because most people presently cannot find easy access to or even afford specialized doctor or specialized medical services. Therefore, this limited access means that until one gets to a specialized hospital like this one at Mulago, they cannot know their status of health, especially for conditions that require specialized medical care.
Other hospitals are coming up. So therefore, in the near future, that medical tourism of yours, of going to India, should stop.